weeks of coding roundtable, and which is hard to believe. Seems like we just got started. So, hold on, I'm trying to make sure my cord doesn't get wrapped up and start cutting out. So this week, I'm going to look at the coding roundtable, and then because there is the presentation that Professor or Dr. Campbell had placed in the, for me to post, it was basically showing the 3M, how to work 3M, in which, I've done this for a few weeks now. So I thought that maybe what we would do was I would answer any questions you guys had about the problems. I know some people were having problems for some of the questions at the end of the chapter. So I wanted to answer questions. I definitely don't want to be all over the place like I was last week, and I apologize to everybody. I was just ADDing and trying to answer questions, trying to, move about the screen. So I apologize for that. That was my fault. So let me share my screen. I was just getting into 3M. So give me 1 second. There we go. All right. So this week in the coding roundtable, they are doing a bilateral percutaneous Achilles tendon lengthening. And I was noticing some of your all's comments when I was sitting here, even though I was trying to work. That's how ADD I was. Interesting, in your all's, the way you guys were looking at it and all that. But, when you think about the Achilles tendon, that one of the very first things I think about is my ankle. I mean, it's like the ankle region. And so I think that this is where a lot of people are going to get kind of caught or hung up, is that when we go into iLab, if you'll go into the coding references, let me pull up the coding references this way, if they will pull up. Sharon, yes, and a lot of people think the foot too. I'm sorry, I have dual screens, so it wants to go up on the other screen. So if we get out the anatomy plates, and let's go to the musculoskeletal system. Let's go to the muscles of the lower leg. Well, it helps when you're in the tendons and not the muscles. Tendon, sheaths of the ankle, soles of the foot. I don't know if it's going to show it. Here we go. So if you notice, this actually doesn't, well, it does show it right here, but the Achilles is the lower leg. It comes down from the leg and then attaches onto the foot, but it is considered the lower leg. Dawn, I had it on the other picture. Hold on. On the muscles, let me try yep, there it is. Good eye. So here it is. It's actually a fairly long tendon. So this is, how far it goes down. And so, most people think of it just being right here. And so that's why I think that a lot of people may have gotten tripped up on this a little bit. So if you know now, the Achilles tendon is the, a lot of times we go based upon what our knowledge is, of what we think is, whatever muscle and or whatever tendon or whatever ligament, and it may not be actually, it may actually go further, or it may, be different. So I just wanted to show you guys that. Let me now pull up 3M, and I'm going to go through the code book as well as the regular the encoder. So all right. So let's first look at what they did, though. There we go. All right. So they put the foot up. Remember, all this is just to get to where they need to get started in cutting. And so remember, this is a percutaneous one. They've already identified that. So even though there's a stab incision, it is a small incision. And so they use a stab incision, and they go in on the medial side of the proximal pole of the tendon, approximately 7 to 8 centimeters proximal to the distal stab wound, and then using a 15-inch blade, the tendon was cut through half of its width through the stab incision, and then a third lateral incision was then made percutaneously midway between the proximal and distal incisors, and then the lateral half of the tendon was cut through the stab wound incision. The foot could then be dorsiflexed, and then they extended, then the wounds were dressed, and then they did the other side. So, well, I'm sorry, I was trying to X out of something. So what they were doing is, if you notice, they're lengthening the Achilles tendon. That's their purpose, is this bilateral Achilles tendon lengthening. Letitia, if you go in 3M, you can either go in 3M or you can go in the references, but if you're in 3M, go to this little stack of books right here, and then when you click on it, it's under the Elsevier's anatomy plates, and then I went under musculoskeletal system, and then you have all these choices. So, does that help? Okay. Let me go back. All right. So, remember, it was lengthening. And I'm going to get out of this. And first thing I'm going to do is go through the code book, just because, it's always good to look at both. So we're going to go to procedures up here if you're using this book. And I'm going to go to lengthening. I'm going to type in lengthening in. And if you notice lengthening tendon by incision, it says C division tendons. So it automatically is sending you to division. So we have our first start is medical surgical. We have tendons, division, which is cutting into a body part without draining fluids and or gases from the body part in order to separate or transect a body part. So then next we have tendon, and this is where I think people, at least some of what I was seeing, were getting confused. They were wanting to use the foot or the ankle, and when actually it's the lower leg. So I'll start off with the lower. They don't have a bilateral option in this situation, so we're going to have to code each one separately. So we have, I'll choose the right first since it's on top. And then it was done percutaneous, and then no device, no qualifier. So, and then the second one is going to be, again, division by incision, and then it would be the lower leg tendon left, percutaneous, no device, no qualifier. Don, you don't agree with the division? Okay. Okay, so let me go back to the regular encoder. This week, when you start working on the male urinary system, this is where you're going to have to make sure and change the gender to male. Otherwise, you're going to run into, or you could run into some trouble, in case you happen to, have a male body part that you're, trying to code. So at this point, I don't really care if it's a male or female. I don't care their age. It's not, a newborn. It's not a mother getting ready to deliver. And that's, whatever reason, 56 is easy for me to just type in. So that's the reason I chose that. So if I go lengthening of a tendon, it's going to be lower extremity. And here's another little thing. If you look, you can click on ankle, and though you may think, okay, well, that is the ankle, you have to take in consideration this thing goes all the way up. Well, not all the way up, but half the way up. So if you click on these little guys right here, you're going to see, what you're looking for. I mean, as far as the same plates. So this does state in 3M it includes the Achilles. So I'm going to go lower leg left first, because that's first on there. It was percutaneous, and this is strictly I'm just ignoring that ICD-9. So, and then we have lengthening again, lengthening of a tendon, lower extremity, Achilles, percutaneous, and that's it. We don't code the casting. That's included in the overall procedure. They're going to put a cast on it all the time. The only time we really code casting is if they come in and normally it's like an outpatient procedure, so they aren't going to put, you're not going to be coding PCS, you would be coding CPT. And so what you would be, the only time you cast is if there's like a fracture and, they come in for a cast, not because of, they're doing a orthopedic surgery. Why would it not be release? Let's see. Let me look at, I'm sorry, there's so many questions. Okay, non-displaced fracture, Michelle, I'm not sure I understand your question. And then Sharon, that's not the only reasons they'll cast, Sharon. There's other times, that was just an example. See, and I'm putting reasons. You said release. So release is freeing a body part from an abnormal physical constraint by cutting or use of force. Release, you normally see this, okay, it does say Achilles tendon release, and that is an example. However, in this case, they were lengthening it. They weren't just releasing it. They were actually trying to make it longer, and so they divided. I see the dilemma, and I think if they had stated, Achilles tendon release, that, let me see. Let me get back over there. Was used the medial half tendon through a second stab incision made on the medial side, approximately 7 to 8 centimeters, blah, blah. Tendon was cut through half its width through the stab incision, and the lateral half of the tendon was cut through the stab, and the foot could be dorsiflex. His purpose is to, this is the purpose, is to lengthen it. And so, that is why it's not considered a release. It's, because their purpose is to make it longer. Whereas for this, it's to free a body part from an abnormal physical constraint. So if it's, I think this is more if it is it's taking restraining tissue out. So it's a little bit different. And the problem with a lot of these root operations, even for us, people who have been coding for many years, the verbiage kind of makes you go, well, could it be that one or could it be this one? I think that it's because their purpose was to make it longer. I think that is the reason that you would use the lengthening or division. Yeah, you have to look at what the purpose or what the reasoning is behind it. What are they trying to accomplish? So, when you put in division, so division was, again, cutting into a body part. So it doesn't even saying transecting it. In order to separate or transect a body part. So it's, they were cut into 3 different places so that they can, basically, it's basically to make it longer. I don't know that I have a great answer for that. It does seem weird, Dawn. I completely, and I can see your point of view. So, any questions on this? Besides obviously the one, you have some great questions, and, I appreciate the questioning it, because, and sometimes I don't have a great answer for it. Sometimes it's just, it is what it is. So, June, let's see, it could be, it definitely could be. If you were audited, it would be considered incorrect. So, the coding would be considered incorrect. As far as the reimbursement goes, that's, even if it's coded right, a lot of times it's not reimbursed. Not just that, but in general, things aren't reimbursed. So, what questions from this week did you all have? Or what can I answer? I knew somebody was going to be ready. Let me go to the ebooks. Can you tell me what chapter that is, Michelle? If it's that bad, I may have to get out the answer sheet. I'm just kidding. Okay. Page 345. Oh, I can use this, can I? My bad. I forgot. Well, apparently you can't just type the 45. Okay. Oh, not the knees. Okay. So y'all know the answer already though, right? Maybe I need to know what I'm going for. Okay, they did a resection of the tear of the lateral meniscus posterior horn, reconstruction of the anterior cruciating ligament using patellar tendon graft. Okay. And I'm just reading, so give me just a second. Compartment with an initial cruciating ligament resected using a shaver. Excision. Okay. So with the arthroscopy, they've done a couple of things. Y'all are killing me. All right. So one, you don't code the diagnostic arthroscopy if they do something more, meaning, let's see, but the probing underneath the surface of the posterior horn, there was a partial tear without any instability. The tear extended back. So because of this, a portion was resected back to the normal cartilage, removing the torn segment. This was an area that was not vascular. So arthroscopically, they did, and I'm writing notes down because I will forget, the tear was, because the portion was resected back, so they resected let's see, partial tear underneath the surface of the posterior horn through the cartilage. So the lateral meniscus of the posterior horn. Okay. All right. So let's see what, and then attention was turned to the anterior cruciating ligament, which was resected. So they resected the anterior cruciating ligament was resected. Using a shaver, all the soft tissue was removed from around the side of the notch, and a burr was used to enlarge the notch superiorly into the lateral side and the depth. Okay. Now, in all honesty, where this gets really ugly is in CPT. So just to let you know. All right, so first thing I'm going to do is I'm just going to type in arthroscopy, because then it'll already get me to the area that I'm looking. So I'm in the knee. And so what did they do? Let's see. First thing they did was they did a partial resection of the lateral meniscus of the posterior horn. So I can never say that word, meniscectomy. Let's see. Excision, joint excision. I'm just reading. That's all. So I'll make sure. So if you click on the question, it says involves removal of damaged tissue and codes to the root operation excision. When a chondroplasty, debridement, or shaving a cartilage, or a synovectomy are performed in conjunction, they are considered integral to the excision procedure and not coded separately. Okay. So, anterior portion, the lateral meniscus, of course, I don't know what knee joint it is. Let me get back over there. Hold on. The right knee. Thank you. Right. They also did a anterior cruciating ligament resection. Not a graft. This isn't the best way to go. Hold on. Let me go this. I'm going to try it a different way. So they did a resection, which is excision, by the way, because remember, excision is partial body part, and they did a portion. Then it was, let's see what this is going to be under. Nope. I don't want bones, people. Let's see if lower joint. I can get it this way. Nope. Tendons. Medial meniscus. Medial meniscus. Just had a moment. Medial meniscus, is that a ligament or a tendon? I had a senior moment, hold on. Medial meniscus of the right knee, torn anterior cruciating ligament of the right knee. Okay, the anterior, of course, that's a ligament. Lateral medial meniscus. Let me go this way. Back. I don't know if it's going to be under. Try it this way. Excision of, okay, there's one code, the excision of the right knee joint, percutaneous approach. This is I9. I'm just going to choose something because I'm not concerned about it. Let me, was that one of the codes? Good. Did y'all see how I got that? Because I know I was all over the place. Okay, let me, I ended up going into, okay, yes, I will do it again. It's my fault because you know what, if I'm not prepped, in all honesty, when you code, a lot of times that's how you do. You'll be like, okay, well, it's not taking me that way, you know, which way do I need to go? So don't think I'm just willy-nilly about it. It's honestly, that's what you end up doing. So I ended up going into meniscectomy, however you say that, meniscectomy. So you can either go that way or you can go meniscus procedures knee, either one. And I think I went meniscus procedures knee. Then I did meniscectomy. I'm going to hurt myself on that word. Lateral knee joint right. They did it percutaneous, meaning arthroscopic, or percutaneous endoscopic. And then ignore this question because this is an I9 question. If you notice, your code's already up here. So I'm just choosing something. It doesn't matter about the I9. So that's how you get it. Does that make sense? I think it just depends. In all honesty, it depends. Yeah, I'm not sharing whatever it's that word, but not quite that word. Michelle, okay. Yes, and Letitia, in all honesty, that's how, if I can't get a certain word that a doctor's saying to go into the encoder, I will say, okay, what else does that mean? How, is there another word? It's like trying to fit something, you can't always fit it in a pretty box. You kind of have to look around and see if there's a different way to get it. Dawn, there you go. Ask Google. I didn't have Google, so I had to ask my brain. Let me go back. Right here, well, one, they said they did a resection of the tear of the lateral meniscus of the posterior horn. Let me see. And in all honesty, I think that is where I got it. Yeah, because I don't see it right here, but he did go into a little more detail here. So that's where I got it. And now I'm going to do the anterior cruciating ligament resection. Well, it helps when you do procedure and not diagnosis. So resection and not resection of an ectopic pregnancy. Resection, and now I have forgotten if that was, attention was turned to the anterior cruciating ligament, which was resected. Using a shaver, all the soft tissue was removed from around and up into the notch. A burr was used to enlarge the notch superiorly into the lateral side, the notch, Okay. So it sounds like it was, do you all think that, based on that, do you all think, I'm just asking your opinion, do you think it was completely resected, meaning a whole body part, or do you think it was a partial based upon that? I'm just reading your all's answers. Which was resected. All of the soft tissue was removed from around the tip and the notch. I think it was the whole body part. I think, and this is one, because Sharon's right, they don't normally say partial, but yeah, they do say partial, but they're replacing it with a graft, and so that's making me think that it was the full thing. So let's do the whole total body part. And it was a ligament. It was lower joints, so maybe it's of course they're going to have tendons and not ligaments. Let's see. Oh, duh. Special moment. Sorry. Okay, knee, right. That one was also arthroscopic. Was that one of the... Was that one of the codes or no? Watch it be no. Tell me what the code is, so at least I can look at it. Well, supplement is, yeah, that's when they go in and do the graft. But apparently there was 3 codes. O-M-U-N. Okay, it's not going to let me do it. Okay. O-M. Well, that's for the graft, but they don't discuss the arthroscopic part of the excision of the ligament. They only do the graft. Let's see, OLB, QOZZ. QOZZ. Okay, excision of right knee tendon. Where are they getting that at? Hold on. Excision of right knee tendon. Because supplement is when you look up when you put in supplement means putting in or on a biological or synthetic material that physically reinforces or augments the function of a portion of that body part. So it's not necessarily replacing it, it's encouraging it, it's reinforcing it. So with that being said, yeah, that makes me wonder if it was all taken out, but I need to know where that excision of the right knee tendon is coming into play. So hold on, because I would have coded the ligament resection, then the open graft. Let me, hold on. Oh, come on. Trying to see where they, sorry, it's not how I intended it to go. Thought they were going to do that one page, but of course not. Okay. It's harvested with the bone graft from which was size 2 threads. Okay, so they harvested it. That's why. Okay, gotcha. So I guess with the resection and the supplement, they're not coding the resection of it, but they're coding the supplement of it. Interesting. Well, because if you think about it, what they are doing is they are enforcing this with this graft. And so because of that, they are, I don't think that, let's see, resected. I think that if you look at it like in the sense of something being, well, another supplement, when I think of supplement, I think of mesh. I'm sorry, I'm just thinking out loud now. So if you think about, so if they do a graft, so like if it physically takes the place of the function of the body part, then that's what it is. It can be a transfer, and then root operation supplement may be coded when a body part in the skin, subcutaneous tissue, or other tissues is not provided in the transfer root operation table. Supplement is also used for grafts to fill in defects using body parts such as muscle, tendons, nerves, or bone. Because the part removed is part of the joint. Okay. Let me delete my code. So these are the 3 codes that it has, correct? Okay. So I can see this is the harvest of it. This is the harvest of the tendon. They took the tendon out. That's the you know, when you code a hip replacement, and this is, I'm just thinking out loud, when you code a hip replacement, you don't code them taking out the ball and, you know, the hip, you know, there's a ball there, and you don't take out the, you know, you don't code that part. You code strictly replacing it. And so I think that's the same thought process here, is that you are, you know, you don't code that initial taking it out, but because they're putting something in there to, you know, either replace it or whatever, I think that's the reason they're using supplement. And y'all are having a whole conversation on your own. Let's see. Separate is not coded when a part of a joint, only the supplement. There you go, Ann. And let's see. So Ann's correct. It's a separate procedure, is not coded when it is part of a joint, only the supplement. So, but think of it like what I just talked about with the hip replacement. Like, we don't code the excision of the ball being taken out. That's kind of included in the procedure. Of course, you're going to take that out in order to put this in. And so, of course, they're going, you know, because there's a big tear in that ligament, they're going to take it out so that, or they're going to take, you know, partial of it out or whatever, so that they can then put it or supplement it back in. So that's the reason. That one was a hard one. You know, knees can be very confusing. Any others? I think I should have my answer sheet up. You heard, my brain has worked too hard today. And no, I wasn't kidding. No, that's not what I want. Answer key. Tracy, there are numbers, not numbers, the answer key right here, in which you have the entire class has access to, has all the answers in them. So in the back of the book, there's only the odd questions, but you have in the doc sharing, you have access to all of them. So, okay. So no, I wasn't playing. I got to go back to what questions you all have, and I got to get to chapter 15 in my. I've been working since 6 a.m., so give me just a second. Okay. Okay. Chapter 15, number 5, operative report. Okay. And I want to make sure I get the right one. Hold on. Because I know there's multiple. Is it these that okay, it is the operative report. Okay. Tracy, because it does come out with because there is, we do have answers to all of them. So, okay, so number 5. And I maybe lost some, okay. Okay. Here we go. Oh my goodness. Okay, we have a right thumb crush injury, open fracture of the head of the proximal thumb. That's not a procedure, by the way. Well, unless they're actually fracturing it, but, and then tendon restoration. Okay. Open, vigorous, irrigated, fracture was open, fracture site was irrigated and debrided, fracture site was curated, multiple loose bone fragments were removed. Chapter 16, number 5. Okay. That's okay. No worries. Katrina, no, you can't just go by the procedures. It's okay to look at them and to, kind of see what they're doing, just kind of get a feel for what they're doing. But overall, they may get in there and do something else. Arthrodesis. Okay, so they did decompression and arthrodesis. Give me just a second so I can at least see how many codes I'm going with here. Okay. I'm just reading for a minute. So head was okay. Okay. Was why release and not excision of the disc. Okay. It's because the nerve root is what's being released. It's not because the nerve roots are trapped in there. That's the problem. And so that's what's causing their problems, basically, is it's being compressed. So they're going to release them and get them free from the constraints. So let's see, needle was placed into the disc space, self-return. It was the portion of the disc material was removed after the posterior longitudinal ligament was opened. Soft disc material was present in this region, protruding against the dura and pressing on the nerve root, which was now fully exposed once the ligament was opened. The protruding disc was excised. A careful search with the use of the operating microscope for only fragments was accomplished. Dermatomal somatosensory voc potential came down to good, back into normal. Then interbody fusion dowel was chosen to fit the opening, and they put in screws and a plate, and final AP and lateral, they were x-rayed and then closed them up. Okay. Interesting. So it's, ew. And the release is performed through an open approach, no device or qualifier. Okay. Interesting. I have to say that's an interesting one. No, it's definitely not clear, and I understand your concern about the release versus the removal. Let me see. Okay. So excision. And to my understanding of reading that, it was the total, let's see, portion of the disc material was removed after, okay, soft disc material was present. The protruding disc was excised. So it looks like the whole disc was taken out. Let's see. Urinary, respiratory. So I need upper bones. Vertebral disc. Let me go back and do it a different way. I'm going to go vertebral procedures, so see if it shows up this way. A discectomy, cervical, they did a resection. No spinal fusion. Interesting that it's very interesting about the answers. Release is performed through an open, no device or the fusion. I mean, I understand the fusion and the plates in the screw. Oh, they did do a fusion, but I didn't choose to code it that way. But well, They did use okay. Yeah, the way that it's being pinched, basically. Let's see. Let me go back because I'm not quite. Let me look because I see what your all's question is, because I would have used resection of the vertebrae. So hold on. Release. Freeing a body part. I mean, I understand that. I understand what they're saying, but I don't know that I agree. And I don't know that I have because they did a decompression. That's that money, that's where it comes in. It's still taking me this way. Hold on. Okay. Yeah, y'all are making me think too much. If it does say that, see, this is what I'm trying to figure out, because I did go decompression, and then it's taking me. Let me see what the book does. Well, that's not going to help me. And that doesn't help me either. Okay. Yes, definitely chocolate will work. Okay, so if we release, can we just say we give up on this one? Let me just put in the codes that they're saying so I can at least. Peripheral nervous system. They released it. Cervical nerve. It was done open approach. All right. Then they did diffusion. The cervical joint. It was open. It was intra-body fusion, and it was anterior approach, anterior column. O R H 1 O internal fixation. So that's just I understand so ignore my code. I understand the fusion and the insertion. I'm not 100% in agreement with that release of the cervical nerve. I understand that was what they were trying to accomplish. However, they excised a disc. So I agree with you all. That was confusing. No, it's not going to be on the final. That's 3, June. Those are the 3 that are correct. And that you have the answers in DocShare, so you can always look them up. It is, they put in plates and screws in there. It's just, I don't know how to, that's just what it's called. Yes, Dawn, don't yell. It's too late for that. Okay. Yeah, so there's 3 codes. Again, I don't agree with the release. I do understand it, but I think I would have an additional code with the excision, just personally. So just know that it's not easy even for me. And I'm not going to blame, a long day on it. It's, some of these you really have to, it just takes a lot of practice. So don't feel bad if you didn't get it, because obviously I didn't get it. I don't agree with it, but, it's not, you're not always going to, that's how we learn. So I'm going to ask a colleague about that if she agrees with that. And if she does, then I'll let you guys know next week. So, all right, guys. Well, if you have any other questions, here's my email address. So let me, send me an email. I'm out of the country Thursday through Sunday, but I'll be able to check email and, do all that. So I hope you guys have a great night and have a wonderful rest of the week. And thanks, guys.